Well, welcome everyone. I'll go ahead and get us kicked off here. We're at 8 o'clock. I know it's an early morning breakfast session. I hope everyone has their coffee or their tea and their breakfast and are joining us for what is certain to be a very engaging and I think frank conversation with some good practical advice to help us all as we think about different ways to bring the science and faith community together. My name is Jessica Baumgartner-Zuzik, and I'm with the Alliance for Peace Building. And like I said, I'd like to welcome all of you to our session on bridging science and religion for peace, thinking through how faith actors and the scientific community can work together in times of crisis. So I've seen quite a few names on the side of attendees who are joining. Some of you I'm very familiar with, others may be brand new. If this is your first time at PeaceCON or in exploring this topic with the Alliance for Peace Building, at least from our point of view, our work on interreligious action, which encompasses anything involving faith, interfaith, intrafaith, faith-based, interreligious, we're really focused as a secular organization and helping to prove the effectiveness of interreligious peace-building programming. That's both in terms of understanding and proving impact, but also in policy and advocacy to seek greater funding within this field. We believe very strongly that we need inclusive, participatory, whole of society efforts that engage the full community to bring about sustainable peace. And that involves the critical role that faith actors and the faith community play within not only areas of conflict, but of course, areas of sustainable peace. And we have seen historically that religion can be a force for both cohesion and division. Throughout history, there's often been these two broad constituencies, this idea of religion and science, and in many ways, they've been separated or even put into conflict with one another. We, at least at Alliance for Peace Building, don't believe that these two views are incompatible, that one can only adhere, say, to science, this secular or rational or rigorous approach, or one can only adhere to religion, this idea of personal belief. Our research, alongside other critical advances in establishing the evidence base, have shown that inclusive peace building, as I was talking about to begin with, particularly through the engagement with the faith community, is not only more effective, but has more sustainable outcomes. And we really strongly believe is the foundation for how you can work effectively at the community level, because faith actors play such critical and unique roles in society. They help build resilience across communities. They are key actors in uplifting voices and acting in the stead sometimes of marginalized communities. They advocate for long-term social justice. And in many ways, they are these gatekeepers who are able to bridge political and societal divides. In our current society, there are so many urgent multitudes of crises that are facing our planet. Our conference is themed COVID, climate, and conflict. And when we think about COVID-19's long-term impact, as well as climate change and what that means for our current society, our future generations, things like aging societies, lowering birth rates, the rise in authoritarian rule, forced migration for any multitude of reasons, it's indisputable that we need the full community's mind power and capacity to address these crises if we want more resilient, peaceful, and just societies. So today, I'm going to turn this over and we're going to hear from practitioners from both the faith-based, scientific, and private sector communities and implementers to help share some of the best practices they've learned through their work to align faith and science for positive change. I'm joined by four amazing speakers. I'm going to give you a very brief bio on each of them, but then going to hand over for their contributions. We're joined by Dr. Uzma Syed, who's a board-certified infectious disease specialist and the chair of the COVID-19 task force. She's also the director of the Antimicrobial Stewardship Center of Excellence at the Good Samaritan Hospital Medical Center. And I'm so pleased that she was able to join us today in the midst of doing her work at the hospital. So thank you so much. She's also a member of the Muslim American Health Professionals and a core group member of the Faith for Vaccine multi-faith movement. We'll then turn to Tahil Sharma. He's the regional coordinator for North America for the United Religions Initiative and has been working in interfaith movements since 2012, following the Oak Creek Gurdwara shooting in Wisconsin. He also serves as an interfaith minister in residence for the Episcopal Diocese of Los Angeles and is a board member for Sadhana, a coalition of progressive Hindus. He'll be speaking to us in in his personal capacity as an interfaith activist today. We'll then be hearing a little bit from George Halverson, who's the chair for the Institute for Intergroup Understanding and the former CEO for 5 health plans, including Kaiser Permanente and Health Partners. He's written 4 peace and instinctive behavior books, 6 healthcare books, and 1 book on child brain development. And he served on multiple boards in the past and is the chair of the Commission for, is the past chair of the Commission for Children and Families for the state of California and the Healthcare Governors for the World Economic Forum. He's also a senior fellow for the Alliance for Peace Building. And finally, we'll hear from Dr. Muhammad El-Sanusi, who's the executive director of the Network for Religious and Traditional Peacemakers. He was also the director of the Community Outreach and Interfaith Relations for the Islamic Society of North America and served on the core group task force for the Department of State's Working Group on Religion and Foreign Policy, and is also one of the core group members of the Faith for Vaccines multi-faith movement. So I'm going to step aside and hand this over to our amazing speakers. We'll start with Dr. Uzma Syed, who, as I said, has graciously joined us while doing work, and we want to make sure she has time. So Dr. Syed, please.
Thank you so much, Jessica. I want to thank everyone for the wonderful invitation and for hosting this amazing event. And thank you to everyone who's joined us today. And I'm really delighted to be here and to speak with all of you. So I'll start off by just saying that all faiths essentially have a unifying principle towards the preservation of human life. Now, during the COVID-19 pandemic, I saw firsthand how much this virus was causing disease, disability, and even death. Being on the front lines, it was and continues to be like a war zone. Seeing countless people suffer, be in agony, and die day in and day out. Initially, our efforts were very much focused on mitigation strategies. We needed time and we needed science to guide us throughout this pandemic. Once we had made scientific breakthrough with the global community, the entire global community working together for a singular purpose on vaccine development, we had proven to have a safe and effective vaccine, which was our strongest tool in our toolbox that we had. Unfortunately, there really wasn't as much emphasis on vaccine education for the community as there was on vaccine development. And very, very quickly, we saw the infodemic of misinformation in addition to disinformation really take over, and vaccine hesitancy was prevailing. That's exactly where trusted messages from trusted messengers came into play for a pivotal role in our fight in this pandemic. Now, Faiths for Vaccines is a prime example of that. Under the leadership of Dr. Muhammad El-Sanusi, a core group of faith and science leaders convened and strategized on how to support faith leaders across the country and provide them with the tools necessary to be successful, to provide vaccine education, to provide vaccine equity and access to communities. Now, the success of the vaccination campaign in the US can really largely be contributed to local grassroots initiatives such as ones led by clergy and in houses of worship. Many people who are really hesitant about vaccines and trusting science because of the history in this country with marginalized communities and lack of access to trusted and reliable resources naturally turn to clergy for guidance. Now, providing education and access to people in a familiar place and a place of comfort was really key in building those networks to ensure that health and well-being was there for all of our communities. We saw that a purely science-based approach would really fall short because of mistrust of the scientific community in many communities. For people who were most impacted, the same people who were disproportionately affected in this pandemic, these were the same people who really didn't have access to trusted resources in science. Many people don't have primary care physicians with whom they have a rapport with whom they have trust-based relationships with. Rather, their healthcare is really based out of emergency room visits. Now, this creates really an imperfect environment for building vaccine confidence. You have a person who comes to the emergency room to seek medical care and is really getting their very first information about a new vaccine during the midst of a pandemic from a complete stranger on their initial first encounter. So you can imagine how much discomfort this creates for that person. Now, similarly, if we had just a faith-based initiative alone, We know that this may not be effective either unless it was backed by science, because the faith communities really needed the resources from the vaccination trials. They needed scientific insight and really the ability and the tools to debunk many of these myths that were circulating about vaccines. So as you can see, it was really a beautiful collaboration between faith and science, which really brought about the most impact for communities, large and small, to really make strides in this pandemic. Now, I just want to showcase a couple of highlights, some key lessons that we learned along the way in order to promote safe environments. What we learned was it's really, really imperative that we focus and emphasize on having that trusted space, promoting a safe environment, listening to people, meeting people where they are, being empathetic to people's concerns and fears, really acknowledging them, offering them their support without the expectation of a particular outcome, but always having an open door to welcome people back. A lot of times we learn that it may not be that first encounter which will convince people to take the right steps towards their health. But you should always have that open door policy so that people can come back for that second or third encounter, or even a fourth conversation, until they're ready one day to hopefully accept this life-saving vaccine and to really put their healthcare first and foremost as a priority. Thank you so much.
Thank you so much, Dr. Saeed. What a wonderful way to start us off, thinking through a practical example of how the Faith for Vaccine initiative brought together faith and science and some of those really key lessons in terms of providing this type of integrated programming moving forward. So thank you so much. I will acknowledge, of course, as I said, Dr. Saeed does have to drop off today at some point. So I'll say goodbye to you now, just to let you know that we're so thankful again for your participation. So thank you. So we'll turn now to Tahil to talk a little bit about some of the best practices on engaging youth and partnering across faith communities through his work as an interfaith activist. Thank you, Tahil.
Thank you, Jessica, and thank you, everyone. Good morning. Hopefully you all are able to hear me properly and the connection's working okay. Much of what Dr. Saeed just mentioned this morning is very important to think about in the larger context of this engagement between the religious communities and stakeholders and the scientific communities and stakeholders and their alliance in being able to do this work. The question that actually does come to mind now is, where is the connection to those people who might be under the age of 35? Many times it is, younger people in this larger question about the truths that have to be handled in our context of understanding religion and science, that young people are asking the questions about what is relevant to our struggle now. As many of you know, in the past decade or two, younger people seem to be less affiliated with major institutions of religion because of the role of relevancy and the role of justice work that impacts the way in our relationship to this higher power that we may consider ourselves connected to. But what ends up happening is this loss of connection with specific institutions ends up being an important conversation around how we're actually connecting to this larger idea of truth that the current pandemic of COVID-19 has also brought to question because of the misinformation trade that has entered a lot of digital platforms. So young people have played a significant role in being able to challenge the misinformation trade as it's naturally traveled into many of our religious communities and within the communities of our elders, while at the same time being able to challenge the status quo of misinformation that is now coming in because of the pandemic. We've seen this intersection between religion and science come to play in many ways with relevant topics such as mental health, where a lot of times millennials and Generation Z individuals will often find a balance between being able to go to professionals to be able to find certain forms of support, while at the same time turning to religion and spirituality for its redemptive and restorative practices in being able to find sanity and peace. As we turn into the work of what we see now with trying to get people vaccinated, it became very clear that there were a lot of different ways that people were challenging this work. Some made it very institutional, made it very intentional, But you come to realize this challenge of the intersection between religion and science actually would just be a conversation that many people would have at home with their own families and communities. This is where the same, young people that would be going out into the world doing their daily routines now become the translators, now become the fact checkers, now become the people that people turn to for the important information that they need about resources in their community. And this is where we come to realize that young people will continue to play a major role as stakeholders in this conversation on the intersection between religion and science, particularly dealing with the COVID-19 pandemic and vaccines as well. In some of the personal work that I've done around this, I've been able to work with the Interfaith Youth Corps, which has created a cohort of community members called the Alumni Vaccine Network that have focused on multiple ways of being able to push back against a lot of the questions and concerns that came with being able to talk about the vaccines that have come out, and to have actually helped to provide deeper and more genuine conversations around what role does religion play in being able to not just focus on our condition and in dealing with a pandemic like COVID-19, but most importantly about the aspects of community care that many of the world's religions actually emphasize in being able to focus on this kinds of effort for vaccination. So I worked personally with a couple of local community members from the Latino community in being able to actually put together a resource sheet. Now, for many of you who have been focusing on departments around the world who have been sharing information about COVID-19 and questioning the myths that have come around from misinformation trains, to being able to find out the basic information about symptoms of COVID-19 itself. There's a plethora of information that gets put out there. But oftentimes, unfortunately, we actually tend to have our biases towards even just focusing on English speakers alone. Late last year, John Oliver actually published an episode on misinformation for his show Last Week Tonight, where we come to understand that social media platforms have only actually been prioritizing English-based misinformation. And we come to realize that in a lot of different communities, it's actually young people who are going in as translators and who are going in as people who can relate this information to their families and communities that are the ones that are being able to push that back in context outside of English. So one of the ways that we were able to do it, in one of the many ways that I've been doing this work, has been through actually providing a Spanish-based approach to being able to educate people about what a vaccine is, how it was created, what are ways of accessing it, and which faith community leaders who actually are prominent not just in Spanish-speaking communities, but also in communities that often have a very divided approach to understanding their relationship to science and the vaccine for COVID-19, like the evangelical community in the United States, have had leaders who have shared important information approving the use of vaccines for the sake of community care and the narrative that comes out of many of the world's traditions. And the fact of the matter is, this is where we really need to have people understand where young people can actually play a very powerful role in that shift and that dynamic towards really understanding the intersectional approaches or the relevant approaches to communicating and to building community responsibility. So that's kind of what I bring this morning. Thank you so much.
Thank you so much, Sahil. And definitely, I know you addressed some of the questions that are already coming in. I am taking note of them. If we have time, we'll certainly reach out to them. But thank you so much again for your contributions and thinking through the role that youth can play, as well as some of the, I think, practical options that we can all play in terms of helping to share information and address mis and disinformation. So I'm going to turn it over now to George Halverson, who's going to talk a little bit from his experience, not only in the private sector within healthcare, but also some of the practical work that the Institute for Intergroup Understanding is doing when we think about bridging these roles of religion and peace building as well as science. So thank you, George.
Great to be here. Thank you for having me. We have now reached a really, really important and interesting point in the history of science and religion. We have crossed over to the point where the science now reinforces religion. And when we look at the science that we have at this level, we now see that there are patterns and tools that can only exist if they were actually designed and put in place to exist. So physics, we now have quantum physics that have formulas that are so incredibly powerful and accurate that they have never been once validated, never proven to be wrong. And that's clearly an intentional process. When you look at biology, we've crossed over to the point where we now know what the coding is for RNA and DNA and all of the enzymes, and the fact that now that we understand computers, we know that if there's a code in the process, that had to be intentional. Codes do not happen serendipitously or by mutation. Codes are always intentional, and we now know so much about RNA and DNA that we can actually modify our DNA for the first time in our history with the CRISPR toolkit. So biology now reinforces the basic foundational belief that this is intentional. And we are now much wiser about the issues of sociobiology and human behavior. And we know that we have patterns that cause us to tribalize, to be hierarchical, to be territorial, and all of the things that the Peace Alliance works on. And those are all clearly embedded in us instinctively as patterns. So we have patterns in physics, we have patterns in biology, we have patterns in sociobiology. And the basic belief is that that has to be intentional and that those are gifts from God. So we've got people like Frank Wilczek, George Ellis, Nobel Prize winning economists, biologists who are advocating, believing that this is true, and that the next generation of science and religion ought to be working together. So what we are now getting a sense of is that every religious belief, every faith system can actually have comfort that science is on their side. And each of us can figure out our own pathway to get to the origin of that magnificent process. But it's clearly aligned. This is not something happening separately in basically conflict with itself. So that's the Institute for Intergroup Understanding is working on issues of instinctive behavior. So we're working on tribalism. We're working on the kinds of conflicts that happen when groups define the other group to be a them, and we're supportive, protective of us, and we're negative, and we firebomb and enslave them. So those are very powerful instincts, and they're also embedded in us. So we need to rise above that. We need to get to enlightened levels of collective self-interest and do the right things, and we need to do that with a sense of religions on our side. So we're working with a number of faith groups. We're working with some seminaries now, because the seminaries are finding that it's very useful to have science on their side, and instead of having a debate about whether or not there's a scientific, the atheists have actually lost a lot of ground in this debate, because it's pretty hard to argue that 25 million enzymes in the human genome somehow happen serendipitously. There's clearly an intentionality. So that's what we're working on, and I really am delighted that you invited me to be part of this session.
Thank you so much, George. Definitely some different perspectives, and being able to kind of think through from the different experience that the Institute is having and how you're addressing some of these issues. I want to turn now to Dr. Muhammad El-Sanusi to kind of think through from not only what we've heard here, but your own experience with the Faith for Vaccines initiative, as well as your work at the network. where do we go from here? And particularly, how do we tie what we're learning in many cases in a domestic component in the US? How do we look globally from here as well and make sure that what we're learning transmits outward?
Thank you. Thank you so much, Jessica, and good morning and good afternoon to everyone. And I'm really delighted and pleased to speak alongside esteemed panelists here during this PeaceCON breakfast session. I would like to begin really by congratulating the organizer, congratulating you, Jessica, and appreciate our collaboration and partnership, and also for organizing a pivotal conference to convene leading professionals working on the intersection of climate, COVID, and conflict, and determine collective action to mitigate consequences through a multi-stakeholders approach. I'm really happy that Tahil and Dr. Uzma, who's the leader of Faith for Vaccines, are in this discussion here. As highlighted throughout this morning's discussion, we have made significant progress in supporting equitable vaccine distribution and acceptance throughout the United States. I have been honored to work alongside, Faith for Vaccines core group, prominent religious actors in the multi-faith initiative. And we extremely grateful that Faith for Vaccines was able to quickly mobilize and advance the role of faith actors and communities in supporting vaccinations efforts. The multi-faith community in the United States, as you know, has previously worked on issues both domestically and internationally, as such that, previous collaboration and trust made it easy for faith actors to determine what role they could collectively play to support vaccinations efforts. So not only did these faith actors advance vaccination rates within their own communities, they also helped to strengthening the trust between policymakers and faith communities. Faith for Vaccines work alongside the Biden administration to advocate and advance equitable vaccines distribution, notably among marginalized and minority communities. So religion and science, Jessica, can really complement one another. As already said by George here this morning, as has been the case during the COVID-19 pandemic. Faith actors have served as a trusted messengers and trusted, and sent trusted messages as, the message that formulated by the science, and reinforcing the public health guidelines and lead vaccinations effort within their own communities. So Faith for Vaccines was really honored to welcome leading scientists to our biweekly roundtable, as well as our National Faith for Vaccines Summit that is supported by the Alliance for Peace Building. We were honored to welcome Dr. Francis Collin, a man of devout faith, engaged with faith communities, at the Faith for Vaccine round table, as well as in the Faith for Vaccines National Summit, and he was there really to support the role and the capacity of faith communities in COVID response and recovery effort. So Faith for Vaccines also provided opportunities for youth. And I'm very delighted Tahil is with us here. He was a leader in our youth table, where we held a youth developed and led roundtable discussion. So, basically, the youth itself put together the roundtable, and the table itself provided an opportunity to engage in dialogue session with, again, Dr. Vauci, who's recognized, a scientist in our nation here, regarding vaccines and vaccinations efforts. So we provided that platform through Faith for Vaccine, again, bringing faith youth, faith-based leaders, as well as, scientists. We are people of faith, believe loving thy neighbor is one of the most fundamental religious, components. As I myself, as well as the rest of my family, feel, a great sense of responsibility and fulfillment in knowing that we trusted science and received the vaccine to not only keep ourselves safe, but as a spiritual act of loving thy neighbor, to protect those who are elderly and most vulnerable around us here. While we have made, tremendous strides in supporting vaccinations effort, we will still have a journey ahead of us. Here in the United States, Faith for Vaccines is working to increase booster shots and pediatric vaccination rates, and working to make testing more accessible. So the approval of the pediatric vaccinations for children under the age of 5 will come with a new set of opportunities again for faith communities to serve as trusted messengers in support of pediatric vaccination. In addition, we still have a large percent of adults and children who have yet to receive the vaccine. However, we recognize also that the pandemic will not be over until vaccinations have been equitably distributed around the world. As many leading experts have already and repeatedly stated, we are not safe until we are all safe. So we need to provide the vaccines to the world. We have already seen a multi-stakeholders approach with the inclusion of faith communities to support in global vaccinations efforts. For instance, ACT Alliance has hosted regional workshops with faith communities to identify challenges and best practices in localized vaccinations efforts. We have seen the World Health Organization, in collaboration with Religions for Peace, recently hosted a series of global conferences in order to strengthening national responses to health emergencies through the role of religious actors. We at Faith for Vaccines are, elated to support global vaccinations efforts through a partnership with the U.S. Agency for International Development, USAID. This collaboration has identified 3 strategic goals to collaboratively advance global vaccine equity. The first is to include local voices within the faith community, such as, faith leaders and trusted messengers, to combat misinformation and build vaccines confidence. The second is to impact local health outcomes by working with faith and community actors to drive demand for vaccinations and overcome access and distributions, barriers. And finally, integrate faith and community partners into country-level planning efforts in order to build long-term sustainable solutions to address COVID-19 and its second, order impact. So these discussions this morning, today, provided us with invaluable insight on the importance of the intersectionality of faith and science, especially in relation to COVID-19. So I really look forward to continuing the discussion with my fellow panelists here. Thank you so much, Jessica.
And one quick comment on that last point. The vaccine was actually built by doing exactly what I talked about earlier. They looked at the RNA coding, the exact coding of our RNA, used that coding to build a vaccine in record time, and then had the vaccine set up to trigger our antibody responses in targeted ways. It was genius work, and it was done using exactly that mechanical toolkit that I talked about earlier. And I really believe that toolkit was a gift from God, and it got here just in time, because if we had not had that toolkit, it would have taken years to build a vaccine. We couldn't have done it in months.
And exactly, George, this exact point was really articulated well by Dr. Uzma Saeed during the engagement with faith leaders across the country early on, when we just started actually putting together Faith for Vaccines Roundtable. So really, that helped us a lot actually to push that message. This is not something that is just come, out of the blue, but I think it's the work that is being done for more than, decade or so.
Well, definitely. I know we have tons of questions already rolling in. As I said, I'm so sorry we had to lose Dr. Saeed. She was joining us from the hospital. She was kindly doing rounds to contribute. But definitely amongst Ahil and Muhammad and George, I'm going to give you a brief summary of some of the questions that have come in, and then I'll hand off if you guys want to provide some comments, either from your fellow panelists' discussions or direct responses. One thing that I will share in the chat, I think we've had quite a few comments, but definitely we did, as part of the Faith for Vaccines movement, create an advocacy video that summarizes quite a couple best practices that some of you are asking examples for, and I would encourage you to take a look at that. But we've had questions in terms of, one, what do we do in situations where clergy have played a negative role in spreading disinformation and misinformation, or not, not listening to perhaps other scientific or religious community? What type of roles or responses can we take to help promote greater acceptance of COVID-19 and understanding how, best practices in response? We've also had questions about, and Muhammad, you hit upon this, and George as well, a key challenge when we do not engage with faith actors right from the beginning, other types of challenges that pop up. So best practices on how we bring them in. And Muhammad, I think you talked a little bit about that with some of the work with USAID and the principles that you're adhering to there, but flagging that comment. We also had some questions in relation to addressing different religious practices, rituals, how we integrate them or adapt them in response to changing needs. We saw that during COVID-19, the laying on of hands, the offering of communion, close-knit prayer. How and when can we address some of these issues from a respectful faith-based environment that still promotes the integration of best practices from science? And then also some key conversations on examples of targeted or strategies to combat mis and disinformation regarding COVID-19 and vaccines. I know, Tahil, you have some comments there too. And then finally, just flagging some of the examples that have come in from other opportunities. I think this is important to flag. Importantly, I'm sorry, my son is coming in here. I'll close my window in just a moment. But that we shouldn't see these as contentious communities. And there are examples where this has been incredibly successful. And we're looking at really one unique situation when we're thinking about COVID-19, but there are others, as were shared in the chat. So I'm going to hand it over. I'm going to hand it over to Tahil first and see if you'd like to provide some comments, and then we'll switch back and forth between George and Muhammad.
Thank you, Jessica. I think there are a couple of really important things that we need to think about when it comes to addressing not just currently the COVID-19 pandemic, because I think the nature of the human condition is unfortunately to always be some form of petri dish for how we interact with each other. I think it's very important for us to think about a couple of things. First, the idea that change is not possible, that traditions are not allowed to be altered, it actually runs very counter to the idea of how religion and spirituality actually function at their core. It takes centuries of innovation and changes in history for us to actually acknowledge that things are meant to change and adapt based on how our society is functioning. And the COVID-19 pandemic has been a very solid example of that, where people have been able to engage in new forms of digital and in-person spirituality based on their ability of being able to adapt. This has just given us an opportunity to consider that not everything has to be treated verbatim as a tradition just because generations have done it and it has to stay that way. It just is an invitation to think about what are the new reinvigorated ways of being able to establish tradition in ways that are safe for people while allowing them to still be able to create sanctuary. Secondly, when it comes to addressing disinformation, coming from, major information sort of mills that we found in India, especially to be very prominent in digital spaces like WhatsApp, what becomes very clear is that as much as we want to create a concerted effort that is also like multilateral, where we're trying to really push back against this information, this is the power of the people playing its best role in being able to mitigate the impact of disinformation. The first time that I got access to any kind of disinformation was actually March of 2020, when my mother shared a message from me from WhatsApp that she got anonymously from someone, letting her know that if you eat more garlic, you will actually be able to prevent yourself from getting COVID-19. Many people on this call have probably heard something similar. And the question becomes, as a part of the critical thinking processes of how you engage someone, how do you make them understand the nature of the relevance, the value, and the truth of the information that they receive? This is actually something that we got to speak to Dr. Fauci about during one of the Faiths for Vaccines roundtables, is when you're trying to engage people, the truth is always going to take precedent. And science really dedicates itself to be able to be an all-encompassing truth that requires us to be able to go through the scientific method, to test hypotheses, and for us to be able to come to important conclusions. But that doesn't actually translate the emotions, the viability of information, and the way that information travels. So what we have to do as our own vessels of information and truth holding is try to make sure that we can help people think critically about the information that they have to process. This has to do very much with the community level of engaging the people we are closest to, but this also has to do a lot with engaging institutions and faith leaders who might be taking their own, selfish approaches in trying to deal with a lot of the work that's going on. There still seems to be a lot of pushback from denominational leaders and folks who are kind of within a community who are just doing their own thing, thinking that they can lean into conspiracy theories and the like, when in reality, many of the major institutions, denominations, and organizations that are out there have made it very clear that because this is related to community care, that across faith traditions, you should take the vaccine. So the fact that there's now this sort of theology of convenience that's kicking in, where it's like, oh, yes, the Pope said you should take the vaccine. Oh, yes, these major leaders have taken the vaccine. Oh, suddenly I don't want to listen to them because it's not convenient to my narrative and to my understanding of the situation, so I'm just not going to listen to them. That's where you have to kind of challenge and really think about the ways that you can step in and help that sort of critical process develop, because there's only so much you can do with the truth that if people don't take it for face value, you have to find other ways of being able to deliver it. And that's where storytelling comes in. That's where helping to deconstruct the views of the person really has to play a more important role about where they're getting the information, why was it fed to them, and stuff like that. So it's really about delving into those kinds of things.
Thank you so much, Tahil. George, maybe about 3 minutes, and then we'll close with Muhammad.
Yeah, thank you very much. Relative to going forward, number one, if we can get to the leaders of each of the groups, each of the subgroups, the leaders are extremely influential with the group, and persuading the leaders to go down the right path is a really, really good thing to do. Second thing is social media. The internet has replaced the cave as the place where we interact on a daily interactive basis. And what we need to do is get the social media trains to have positive information about the vaccines and getting it right, getting information instead of misinformation. And the third thing is to, in terms of rebranding it, rebrand the vaccine as a gift from God. Rebrand the vaccine and say that God gave us this gift in this time frame. We should take advantage of that, and this is part of our Eden that's being threatened, and we should use the vaccine and be really grateful that we have it, but think of it as a gift from God and actually make it part of the religious context as opposed to just a separate science.
Incredible. So many key points there that I know we're all nodding heads, but certainly big tasks, even if very practice oriented. However, thank you so much, George. Muhammad.
Thank you, Jessica. And just really building on what George has already said, which is really the framing of the message. As spiritual leaders, how we can frame that message, from our platforms, framing in the sense that, protection of life. As faith leaders, we need to protect life. We're obligated and responsible to do that. How we can frame that and give that theological kind of foundation on the protection of life. So I think that is the best way actually to talk to those who are killers, but they are, kind of promoting a negative story. Right? That could be one of the strategy. And then second, also equipping our congregations and our communities with the right information to be messengers themselves, to take the message from the worship places to their communities, to the grassroots level. That also help in our experience as well. Now, then what are the key challenges that we face when we started Faith for Vaccines? Of course, when I place that first call, Jessica, to the people that, what I call it, the zone of comfort, right? People that I have been working with. But that's not enough. We need to reach to everyone. The whole of society approach that you talked about it earlier, that is very critical. So we'll have Dr. Reverend Jim Wallace. Could you give a call to Walter Kim, the president of the National Associations of Evangelicals, to see how we can have a discussion on this, how we can reach to those who are not, kind of not in our zone of comfort, our interfaith and interreligious kind of circle. So that's really something that is critical. We have to do. Then our rituals, we were able to adapt our rituals, Jessica, and this is from doing the communion, from conducting burial and funeral services. So my friend Rabbi will tell me the way how they actually adapted to the situation in terms of burial and funeral. The Interreligious Council in Kenya, Jessica, was able to come, and actually the Muslim Council was able to come with the new sets of guidelines how to conduct a burial during COVID to protect everyone. And their mechanism was actually accepted by the Minister of Health for the country of Kenya, and it became for everyone, right? And it's a collaboration with the Christian communities and the other religious communities and the Muslim communities to conduct burial that is safe and to protect everyone's life. Finally, I want to say that, Jessica, this collaboration we have done through Faith for Vaccines and the collaboration between science and faith and all of that, we have to use it also to address other crises that we face in the society today, whether it is climate or conflict resolutions that we face. But we have this strong coalition. We need to utilize it. Thank you so much.
Well, thank you so much. We're almost at time. I think that's such a positive note to think about. Is we've given one example here when we think about faith and science and COVID-19. But there are so many, as we started this conversation, other major crises facing our community and lessons learned across both that initial initiative as well as some of the instinctual behavior research that George was speaking about, the mis and disinformation and youth engagement that Dahil was speaking about, the scientific work that Uzma was speaking about as well, also from a faith-based lens, is so applicable in other contexts. In our last minute, I do want to just hand it over to Dahil, George, or Muhammad if you have anything else you'd like to leave our partners with. I've shared many links in the chat. I encourage all of you to take a look at that and get engaged. And we have such leading experts here who are very excited to continue the conversation. So any last thoughts in our last minute? I'll give you each 20 seconds if you have something to share. George, I see you leaning forward. Anything you'd like to share in the last 20 seconds?
You're doing exactly the right thing, building on the faith groups, bringing them into the cycle, educating them and supporting them in the process is a really good thing to do. And the result of that will have long-term positive consequences, because that can then lead to future discussions on other relevant things. And that's, in some communities, that would be really, really good to have that happen.
Thank you, George. Tahil?
Just to sort of remind people that any conversation, even as intersectional and complicated as religion and science, if it doesn't include young people, it might not have a future. So don't forget that.
Wonderful. Definitely an important contribution. Muhammad.
Thank you, Jessica. And collaboration, the whole of society approach. We are facing a crisis that is COVID-19. Let's put this crisis in the center of, on the center of the table, and ask all whole of society, different religions and faith communities to bring from their own traditions how we can resolve this problem.
Yes.
And save everybody's life. Thank you.
Well, thank you all so much again for your time and expertise. For those of you joining us, this is just the start of day 2 of PeaceCon. I think it's really important to note, as this came up many times, our plenary today is on amplifying our collective voice, thinking about narrative frameworks to elevate peace building. And I can't stress enough, all of our panelists spoke about the need for stronger narrative, education, and the importance of bringing us all back to where we can agree versus what divides us. So thank you again. I wish you all a wonderful day, and I look forward to engaging more. And again, please check out these links. There's some really great information there. Thank you so much.